Well, welcome, members of the Board of Health. I think we're going to get started shortly if people want to take their seats. So welcome to meeting 12 of the Board of Health. Welcome to members of the board and to members of the public. You can follow the agenda and debate on your computer, tablet, or smartphone at www.toronto.ca/council. The Board of Health acknowledges the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Before we begin, first of all, can I thank Vice Chair Wong Tam for stepping into the chair's shoes last meeting when I was off taking care of a newborn. I appreciate it greatly. Are there any declarations of interest under the Municipal Conflict of Interest Act? Trustee Lopretti, do you want to declare your interest?
Out of an abundance of caution, I declare a conflict of interest in HL 12.1 because my husband owns a business similar or same to the businesses that are included in the report. Great.
So when we come to that item, we'll ask you to step out of the room and we'll do a recorded vote. And you can hand the form over declaring your conflict to the clerks. Can I have a motion for a confirmation of the minutes from November the 12th, 2019? Moved by Director Perks. All those in favor? Opposed, if any? That is carried. You've had some communications presented here in front of us. As well, on the green sheet, you'll see a list of people here to depute today. If you are a member of the public and you would like to speak, kindly come over to clerks, the lovely folks on my right, and you can register. We're now going to go through the yellow sheets. Item HL, just to do the agenda order, item HL 12.1, ChemTRAC 2018 reporting, held down for Councillor Perks. All right, item HL 12.2, Ontario Public Health Standards Risk Management Reporting for 2019. Director Layton would move the recommendations. All those in favor? Opposed, if any? That carries. Item HL 12.3, update on Vapour products. That is held down for speakers. Item HL 12.4, Toronto Public Health Organizational Review. That is held down for speakers. Item HL 12.5, Audit Committee Item AU 4.9, Auditor General Office 2020 Work Plan. I have an amendment on that, which I think may be quick if people are comfortable. This is to request the Medical Officer of Health to report to the board in the first quarter of 2020 with details on current audits that have been conducted by Toronto Public Health, including details on promoting and ensuring accountability. All those in favor? Opposed, if any? That carried. Item as amended. Do I need to do item as amended? No. All right. So that's taken care of. We have two new business items. Do they need to be introduced? Yes. Yes, they do. So we have on the pink sheets 2 items, one from myself. This is with regard to the Ministry of Health discussion paper and changes to public health in Ontario. I'd like to move to introduce that item. All those in favor? Opposed, if any? That is added. And one from Director Perks regarding anti-black racism training. Adding that item to the agenda. Director Perks, all those in favor? Opposed, if any? Carried. All right, so that's the agenda in front of us. I'm going to do one small shift today, and you'll forgive me. This is the Board of Health, but I have a brutal head cold, and I am in a literal fishbowl at the moment, so I've asked Vice Chair Wong Tam to sit in the chair seat while we switch positions for this meeting to run through the formal business.
All my notes. Oh. Thank you. Pass my report. Okay. Thanks. That's okay. I have a pencil. Good morning, and thank you very much, Chair. We're just moving on back to item number 1, HL 12.1, ChemTRAC 2018 reporting. This item has been held down by Councillor Perks. I don't believe there are any speakers. No, since there's no speakers, Councillor Perks, do you have questions for staff?
Yeah, I'm just trying to be clear. So this is was otherwise originally known as the community right to know bylaw, right? That's where this comes from? Yeah?
So through the chair, yes, this is the ChemTRAC bylaw is sort of how it's referred to in my mind, but yes, it's about establishing the community's right to know.
Right. So when we report this data, I'm looking at the Ward 5 compliance review. Does the public have access to all the data generated out of that?
So through the chair, yes, there is a website, and the full report is provided on an annual basis, and it outlines all the details.
By facility? So I can look up this facility over here, and this is how they complied?
Through the chair, yes.
Okay. And I just go onto the ChemTRAC website to get that?
Through the chair, absolutely.
Okay.
And then a complete annual report is provided every single year.
Okay, thank you.
Any others? Director Wong.
Thank you very much, Madam Chair. So, through you to the Medical Office of Health, what are the consequences for the other 10 organizations that did not complete the audit? Because you indicated in the report that 88% of them completed the audit. What happened to the 12%, and what are the consequences for not complying?
So through the chair, what happens is that we basically work with the facilities to try to bring them into compliance. It's meant to be a more supportive approach, is how I would characterize the approach with working with facilities. There are sometimes those circumstances where, frankly, facilities mistakenly believe that the bylaw doesn't apply to them. And that is, one of the circumstances that I know that we've encountered at least once and several times, I would say, in the past, where there are facilities that misunderstand that the bylaw doesn't apply to them when in fact it does. I can refer to staff if they have specific, we have staff here in the room who've actually had the opportunity to work directly with facilities, but generally what we do is the purpose of the bylaw is to ensure that reporting is in place and to encourage most appropriate behaviors in and around what the facilities are using, producing, and or releasing. The broader context is actually under provincial and federal legislation.
So my follow-up question, Madam Chair, is that are these same 10 companies who are what I call habitual non-compliant? Because if you have data this past year, they have not been in compliance. Are they in non-compliance previous years? Because it is so critical when we have a bylaw that is for everybody, that these 10 companies chose not to comply. And what's the purpose of a bylaw when you just told them that you're not in compliance and there are no consequences?
So through the chair, I'm not sure that it's as straight up or as simple as a choosing not to comply, but the specific details I will refer over to staff because they're able to speak more specifically to the individual organizations.
Thank you.
So through the chair, the groups that you're referring to, the medical officer is correct. They are being supported to come into compliance. Sometimes it's a matter of calculations. The way their data has been presented and calculated needs to be reassessed. Sometimes it's a matter of the company understanding that the information will be made publicly available, and that is the way this particular bylaw functions. Knowing that there will be a public reporting at the end of the process brings companies into compliance.
Thank you.
Okay, thank you very much, Director Wong. Councillor Perks has another set of questions. Are there anyone who has not asked a question? Okay, so let's open it up again to Councillor Perks.
Sorry, I realized I might have missed something thanks to Councillor Member Wong's questions. So companies that are out of compliance because they haven't reported, do they get listed publicly?
I'm sorry, through the chair.
Companies that are out of compliance, do those get listed publicly?
So yes, the companies that are, all the companies that are included and are assessed, even if they're not in compliance, that is included as part of the public reporting. Through the chair, in fact, that's one of the rationales behind the existing bylaw, to actually make the information publicly available as an incentive to fall into compliance. And again, the issue with non-compliance is sometimes around miscalculation, misunderstanding whether the bylaw is subject or they're subject to the bylaw, and a variety of other reasons.
And is that part of what's noted on the website, that they're not in compliance currently?
Yes, that's correct.
Okay. Thank you very much for clearing that up.
Thank you, Director Perks. Any other questions for staff? Seeing none, I have probably maybe 2 or 3 questions very quickly. Recognizing that this report is specifically speaking to mostly Ward 5, what is happening in Ward 5, York Southweston, to suggest this report is needed?
So through the chair, this actually came from a motion at council. There were some concerns that were raised by local residents in respect of odors and that which was being produced or felt to be being produced by local industry. So this came forward through council. There were a number of different directions, some of which we were involved with as Toronto Public Health, and others of which were more under the purview of other city divisions.
Oh, I see. So it's not so much that that as a medical officer of Healthy, you were going to be auditing all 25 wards. This came out of council.
That's correct. There was a specific request given specific concerns by residents of a given ward.
And were there any particular facilities or violators that there were concerns about?
So if I may refer that specifically to staff, that's a granular question.
Sure, through the chair, and then I'll ask if the others that have worked on this want to tag in. So we do this review as part of the program annually and do the annual report. As part of doing the annual report, we included within Ward 5 the facilities who are required to report based on the materials that they use and whether they reach certain thresholds. So we followed the process that we would normally go through. It included Ward 5, so we're bringing a combination report. What we would normally report on the program itself, and then the results for Ward 5. Anything more?
Through the chair, just to add to that, so as part of our regular process, we always audit a sample of facilities across the city. So we typically audit around 10% of facilities. This year, because of the request from council, we did sort of oversample into Ward 5 to audit a few more of those facilities in order to adequately respond to the request from City Council.
Okay, thank you. And what were the facilities that were not in compliance? Like, who were those business operators?
So of the facilities where we found errors in through the audit process, only one had a significant error, which was that they should have been reporting and weren't. That is called Bank Brothers and Sons. The other facilities were what we call insignificant errors. So it might have been sort of a problem with the naming of the facility or something similar to that.
All right, I didn't quite hear the name of the business. What was that?
It's called Bank Brothers and Sons. It's a tannery.
It's a
Tannery?
It's a tannery. Oh, I see. And was that the reason why this report was originally? Were they the original violators that the mover of the motion was concerned about?
The mover of the motion, from what I understand, the residents in that ward were concerned about a number of facilities in the area.
Okay. Okay. Thank you very much. Are there any other questions? Okay, seeing none, the recommendation before us is to receive this report for information. Who is interested in moving that? Director Cressy. Okay. All those in favor? Oh, actually, we do, because I think Director Mulligan had declared okay, Trustee LaPretis declared a conflict. We do need to move to a recorded vote, and I will ask the clerks to call.
So all in favor of the motion to receive for information? Ashna Bowery, Stephanie Donaldson, Angela Johnson, Cynthia Lai, Mike Layton, Joe Cressy, Kristen Wong-Tam, Jennifer McKelvey, Kate Mulligan, Councillor Perks, Peter Wong, and Sue Wong. Thank you.
Okay.
Any opposed? Okay, that carries.
Okay, thank you very much. Okay, so we're moving on to item number 2, and item number 2, I believe, has already been adopted, so we're moving on to item number 3. We do have some speakers on item number 3. We have a presentation, staff, first. Update on aerosolized liquid products, vapor products, and we have a presentation from staff.
Good morning. This is a presentation on vapor products, or as we have called them through this report, aerosolized liquid products. By way of background, this report responds to the medical officer of health, request of the medical officer of health in September to report back on the health impacts of vaping products as well as potential actions for government. Vaping products can be defined as the vapor, or what has been inhaled by a user, which comes from the heating of liquids to produce an aerosol. We wanted to be specific about this definition because there are vaping products available commercially that are benign. These products are anything but benign. So these aerosolized liquid products are also known as e-cigarettes or vaping products, but we use that term throughout the report to point out that there is a risk associated with them. Looking at the next slide, there are both short-term and long-term health risks. Health Canada and many other health organizations have advised that the long-term health impacts of vaping products or aerosolized liquid products are not yet fully known. To date, what is known is that these products can expose users to multiple chemicals that are associated with health harm. Many of these products contain nicotine, which is an addictive substance and is associated with adolescent brain development harm. There are also associations once someone begins vaping with the beginning of smoking cessation, so tobacco smoking, or not cessation, it's tobacco smoking. And this final point is particularly concerning to the public health community because some of the best gains we've made within public health have been the reversal of the use of tobacco. So we're concerned about how things have changed on the landscape with this particular issue of aerosolized liquid products. Looking at youth use, so here we're talking about teenagers as well as those in their early 20s. We've seen incredible increases in vaping use among this group. National surveys will show increases looking at particular years, such as between 2017 and 2018, where there was a greater than 70% increase in the use of vaping products. Recent data that we have gathered even since this presentation was developed show in the Ontario Tobacco Use Monitoring Survey that vaping among high school students has almost doubled. So when we look at 2013, around 15% of high school students were vaping. Now in 2017, we see 29% of students vaping. This increase is thought to be related to 3 issues: product availability, advertising, and flavors. So throughout the GTA, but in particular looking at Toronto, products are widely available. Convenience stores, gas stations, and other retail outlets now carry vaping products. We also see large advertising campaigns throughout the city. Billboards, print ads, pop-up promotional events, social media, all contain promotion around the use of vaping products. In the report, we commend the provincial government for, as of January 2020, removing advertising that was previously permitted in retail stores where youth and children access, but we're asking in this report for there to be even stronger measures to remove the promotion of vaping products. The final area is flavors. So the flavors that vaping products are available in are numerous, and they mimic confection products, pop, and other flavors that make it, as we've heard in studies done with youth in particular, are appealing to youth and are part of the reason they're curious about using vaping products. So flavors definitely play a role, and that's why one of the recommendations we're bringing forward relates to flavors. So the recommendations are in 3 main areas. The first is to the federal government, who are responsible for the manufacturing of the ingredients and, to a certain extent, sales of vaping products. We're asking for a prohibition on the advertising and promotion of aerosolized liquid products anywhere where minors have access. So this means that we would be limiting the advertising just to stores that adults access, which are for the most part specialty vape products, or stores that sell specialty vape products. We're also asking for a prohibition on the sale of flavors so that they are only available where minors don't have access. In theory, you need to be an adult to purchase these products, but when asked, youth say they get, 50% of youth say they get their vaping products from friends. So we want to limit the availability of flavors. And then finally, nicotine concentrations need to be reduced so that there's not the risk of addiction to nicotine within a vaping experience. Secondly, we are asking the Government of Ontario to, within the Smoke-Free Ontario Act, prohibit the sale of flavors. This is in addition to the federal government because it's so important that we get in front of this issue. So there can, within their jurisdiction, the province can limit the sale of flavors to just stores that are accessible by adults. So that would take them out of all of the common areas that youth can go to, gas stations and convenience stores, et cetera. Finally, we're looking locally to see where vaping can occur and make it match the legislation we have now, or the bylaw we have now within our ability to legislate on tobacco smoking. So currently, vaping is not allowed within bars and restaurants, but are under the provincial legislation, but locally, through addition to the tobacco bylaw, we can limit vaping in places such as the entrances to public buildings, so have it 9 meters away. We can also look at park amenities and ensure that vaping is not allowed there where it currently is. And finally, what we're looking at in general is a harmonized approach from all 3 levels of government to really get in front of this health risk. These recommendations are particularly important, as I mentioned, for youth, because in addition to the health risks associated with vaping, youth are at risk of becoming addicted to nicotine, and we've seen the beginning of tobacco smoking following the experience of vaping products use. So strengthening policy at all 3 levels puts us in a good position to decrease the health risk for the public, and in particular for youth, related to the inhalation of aerosolized liquid products. Thank you.
Thank you very much for the presentation. We do have some speakers, so perhaps what we can do is actually invite the members of the public to provide us with their deputation, and then we'll invite staff back to answer questions. Our first speaker is Gary Thompson. Gary, are you here? Nice to see you. Thank you. You want to come up and choose one of the chairs? And I'll turn on your time when you're ready.
Good morning, brothers and sisters. Sounds like preaching the gateway drug effect. I thought that went away like the dodo bird. Trauma, stress, and human nature to seek altered consciousness are causes. I was live a KMH webinar, Youth and Vaping, November 28. Quote panelist Peter Selby, acute lung injury. When the USA looked at the data, more than 80% of cases were from illicitly purchased cannabis products. We are not seeing deaths in Canada. Panelist Dan Davies, quote, Canada removed diacetyl from their vaping products years ago. You have to consider the source of the information. Consider the source. KMH and other health districts teach this protocol. Peter Selby had an office right next to mine. He's the smoking cessation lead for the province. And he growls at me and has yet to explain his quote from the CBC. Overdose puts people into a coma. Doctor, treat coma or cardiac arrest. KMH policy, no smoking or vaping on the premises. Mental health consumers and staff use tobacco or vaping as a stress reliever. Policy causes more stress. They find a way to break the rules or seek other forms of stress release more problematic. When the medical profession fails to follow the moral codes, first do no harm, sure sign the civilization is crumbling painfully. Cognitive dissonance, lie to yourselves and others to protect a core belief. Medical profession, etc., does not willfully cause harm. Councillor Perks, Best Counselor, Now Magazine, November, suggests the board occupy Premier Ford's office, enact Bill 105, proper first aid treatment for overdose, or do as grand prize winner Zoe Dodd, etc., save everyone's life, rescue breathing. Swimming lesson. Grab 20-pound rock, jump in the pool, hold on. 37.5 million Canadians still at the bottom years later. A child knows, breathe or die. This is from the front page of the Toronto Star today. A veterinarian, any animal suffers a respiratory emergency, they give respiratory assist. And I noticed coming into the square today that the city is supporting epilepsy for the holiday season. I've had to pull a parent off their child giving chest compressions to an epileptic seizure patient. Thank you very much.
Gary, thank you very much for your deputation. Are there any questions for the speaker? Okay. Seeing none, thank you. Our next speaker is France Gelinas. Welcome. It's our honor to welcome you to this particular chamber here. Thank you.
Good morning, everyone. Bonjour tout le monde. Annie. As it was mentioned, my name is France Gelina. I'm the MPP for the riding of Nickel Belt in the Northeast. I fully respect that this is not my jurisdiction, but when I saw this motion in front of the board, I thought that I had to come and speak to it. Vaping amongst youth is what I would call an epidemic. The statistics are there. In 2017, it was up to 29% of our youth. None of them old enough to vape are vaping, and the statistics continue to go up. When I became aware of this, I did something that is truly not scientific, but still enlightened me. I put it on social media and said, ask any 17-year-old you know how many of their peers vape. And I just put it out there on social media. The answers that came back blew me away. I would get answers 5 out of 6, most of the kids, 80% of us vape, and it went on and on. When I go, and I do go for the civics class, I go into high schools, and I will ask the kids right there, how many of you have tried vaping? 80% of the hands go up. And then I would go a step further and ask, how many of you vaped yesterday? Just, you know, to put it in perspective, is it something? And over half of the hands go up. A lot of our kids vape. With the Canadian Cancer Society, with Heart and Stroke, with many allies in the healthcare field, I put a bill forward. The bill does 6 things. The first thing is that it bans advertising. The same level of ban of advertising that we have on tobacco would be brought forward to vaping. No supporting clubs, no online advertising, no advertising, period. Then limit the flavors. It would allow prescribed flavors, as in if we find a flavor that really helps smokers quit, and I doubt that, but if we do, then those flavors would be prescribed, otherwise no. Limit the nicotines. We all know that a young person's brain gets addicted to nicotine pretty quick. The Cancer Society talks about twice this try vaping twice with the high level of nicotines, and the kids are addicted. What good comes of having 50% of our kids addicted to nicotine? Nothing good comes of that. Then we have the policies that has to do with the provincial government, where Ontario Health would have to study the effect of vaping on youth, as well as giving the provincial government the right to tax the products and use that money to fund research. 6 things that I realize have all been talked about this morning, but the one that you can affect really quickly and could have a huge impact is advertising. When I and many other Cancer Society, Ontario Coalition Against Tobacco, Physicians for Smoke-Free Canada, etc., asked the kids why they vape, the first reason is that it tastes good. The second reason is kind of putting it back to us that if it was dangerous, if it was not good, well, the government would do something about it. You wouldn't see it advertised everywhere. It wouldn't be so available everywhere. Oh, and I forgot to mention, in the bill, vaping would be, the sale of vaping would be limited to specialty vaping stores. So that's it, that's all. You would not be allowed to come into those stores unless you are 19 years old, and that's the only place you could buy vaping products. No more corner store, no more making it available. So I really, you are the cream of the crop when it comes to public health. You have set policies before that many others in Ontario follow. I encourage you to show your leadership again today and put forward a vote for motions that will ban advertising in everything that is under your control. You will set an example for other health units and other boards of health, but you will also protect thousands and tens of thousands of youth from becoming addicted to nicotine. And my 5 minutes is over.
That's correct, and thank you very much. There may be questions of you. Are there questions for the speaker? Director Wong.
Thank you very much, Franz. Welcome back, and thank you for the team. I know you passed your previous life, but I want to ask you a quick question. You commented earlier about the tax piece, because we know young people are sensitive to pricing. In the report by the medical center, you mentioned about what happened in BC, that they have increased the price on PST as it relates to the vaping products. Would you be supportive of that kind of additional taxation?
Absolutely. So taxations, we've known through the work on tobacco that as you increase the price, it has the major effect is on youth picking up the habit as well as on youth continuing to use the products. But second is that this extra revenue will fund research, because what we hear an awful lot is that, oh, vaping is good to quit smoking. There is no body of evidence that shows this. It shows that, oh no, there is no body of evidence. Why? Because there is no money available to do the work to build that body of evidence. So taxation works, for me, it's a win-win. It works at discouraging youth from picking up smoking, and it gives us the resources so that good people like you at the Board of Health can do the work and have the resources to do the work to show the real impact of vaping on our youth and on society in general.
Thank you.
All right, thank you very much. Our next member to question is Director Donaldson.
Thanks, through you, Madam Chair. First of all, thank you so much for all your work as health critic at the province, and thank you for all your work on this bill. It's very much appreciated. As a trustee of the TDSB, I can attest that this is absolutely an epidemic, a huge problem in our school, and our youth are really suffering because of it. So I just have a question for you in terms of the work that you did to prepare this bill. Has legislation been enacted in other provincial jurisdictions similar to yours?
Yes, So we had British Columbia, who came forward and regulated the vaping industry, as well as we have Nova Scotia, who's also moving forward with regulating vaping. Quebec has started to move in that direction. It hasn't reached the finish line, but they are moving in that direction. And I would say just touching base with Alberta and Manitoba. I haven't heard anything from Saskatchewan, but Alberta and Manitoba are both also interested in moving forward. So you can expect to see movement at the provincial level in a number of jurisdictions. But as I said, you carry a lot of weight. What you do as Toronto Board of Health is looked upon, and not only do you have an opportunity to help your constituents, but it would also help us at the provincial level and outside of your borders.
One further question. I note that the U.S. declared vaping a public health epidemic in September, and do you have any understanding about why that hasn't happened here in Canada and why Health Canada hasn't done the same 4 months later?
So similar to what the previous speaker talked about, the main impetus for the states to declare public health emergency was because of the death that have occurred, because some of the substances are banned in Canada, and because really we haven't got the strong body of evidence to show death. But to me, death is the tip of the iceberg. It's everybody else. When Asthma Canada came to the press release, to the press conference, and talked about the number of kids that show up with asthma-related illness, and then they realize the kid doesn't have asthma. The kid has been vaping, but they are ashamed to say. They're not going to come up and tell their parents that they've done something that it's illegal for them to do. So the wheezing, the lung problems, and all of this all go undetected. And the Minister of Health have asked for our hospital to report on serious lung issue and serious breathing. But this is not enough. It is for every other person who's had a health issue, who's had breathing issue, because none of this is being captured. So again, we haven't got the data to say this is a public health emergency. We could, I think, use the precautionary principle and say, while we don't know enough, we should. But right now, the government is not interested in that.
Thank you so much.
Thank you very much, Director Donaldson. Our next speaker is Director Wong.
Thank you, MPP Gilnes, for coming today. As a pediatrician, we certainly support the work that you're doing in the legislature. My question for you is that this is a private member's bill. How far along in the process are we, and do you foresee any barriers to this becoming a law, and about how long do you think this might take to actually come into effect?
So I've been in the business for 12 years. I've been the health critic for 12 years. I don't give people false hope. Right now, since the Ford government has been in power, 0 private members bill has come forward. I have never seen this before. In every years that I've been there, there has always been private members bill that have come forward. I've had numerous private members bill come forward. Right now, with the provincial government we have in place, I would be giving you false hope if I say that I'm hoping that by such a date it will become law. But a private members bill don't only become law, it brings forward a conversation. It forces a conversation. And whenever I see other people joining into that conversation, I encourage you to bring your voice together and be as loud as we can. We live in a democracy. The government will have to listen. But it will take a lot of goodwill from a lot of people to get to the finish line.
Thank you again for coming today.
You're welcome.
Okay. Thank you very much, Director Wong. Anyone else to ask questions of the speaker? Seeing none, we want to just say thank you for your time and traveling to Toronto to speak with us today.
You're welcome. Merci beaucoup.
Thank you. So are there any other members of the public here to speak to this particular item? Seeing none, then what we'll do is turn this inside and start to ask questions of staff. Of those members who have questions of staff, please indicate. Okay, Director Wong, then Director Donaldson, then Director Pressey.
Thank you very much, Madam Chair. So I do have a lot of questions. It was a great report. I just want to get some clarification. I noticed through you, Madam Chair, to the staff, that there's a lot of references to the lack of data. And we heard again this morning from MPP Gilliland about the lack of data, yet in our recommendation as a board, that there's no mentioning about research. Because unless we get the federal government and the provincial government dedicated resource to it, so I just want to ask through you, Madam Chair, to the Medical Officer of Health, is there something missing here? Is there something going on that's not in the report that we should be asking the province and the federal government to do research on this topic?
So through the chair, we have no aversion to having the province or the federal government undertake the research. We do know that our research partners, universities, post-secondary institutions, are actively engaged in this issue. And in fact, some of the data that are out there, the most current data that are out there in respect of youth usage, are coming from those studies. However, there are sources of data available, whether it's tobacco and other drug use amongst students, more broadly in the population. There are venues to get that information to help inform subsequent research efforts.
Okay. The other question I have through you, Madam Chair, to the Medical Officer of Health, with regard to the long-term effects, is there, like again, on, I believe what page is it, page 4 of the report, it talked about the long-term effects affecting, and there's again not enough data to support it. Is there current Canadian data to address this issue? Because without data, we can't make good choices and decision-making. So is there sufficient resources, both federally and provincially, to address this issue?
So through the chair, to be honest with you, I'm not certain as to what resources are available at the federal and the provincial level to do that kind of research. However, and I'll ask my staff to correct me if I misspeak on this, my understanding is that the products haven't really been generally available since it's 2013 was when we really started having products available on the Canadian market. And regulations and therefore broader availability of e-cigarettes and other similar products didn't happen until 2018. So the issue around data on long-term effects has to do with the fact that there actually has to be long-term use of the product to understand what the long-term health effects are. We do have some sense as to the short-term effects, and in fact, we're seeing some of those things play out in the United States. But to my staff, anything further that I've missed?
Through the chair, that's correct. The usage has increased a lot, but in the very recent last few years. The confirmed cases within Canada are 13. There haven't been deaths, and this is work that the province and the feds are keeping a very close eye on, but there are various thresholds and categories that need to be met for them to move forward. So they are monitoring. What we're doing here is saying that the 3 levels of government who can do things related to availability, flavors, and where you can vape need to come up and provide that policy while we monitor the health effects.
Thank you. The other question I have is, we also heard it this morning from MPP Gilliland about the issue of young people and vaping product. So at present, in this province, in this city, do we have dedicated resources to do comprehensive education and awareness targeting young people? Because this is not a product for seniors like me, okay? Let's call it the way it is. So my question is to you, Madam Chair, to the Medical Officer of Health, do we have dedicated resources right now to address this emerging public health concerns attacking young people?
So through the chair, we do have some resources dedicated towards this. However, as the report indicates, and as we've heard from MPP Jalina, there is a significant amount of advertising and promotion. And we also heard through the presentation that there are various events, including pop-up events, that are, encouraging and actively promoting use of these products amongst youth. That is something that can't be addressed one-on-one. I actually think the policy solution that we're proposing here through this report is exactly what's needed to address that.
So as a follow-up question, Madam Chair, this past year, how many presentation or awareness campaign public health staff has done on this issue in our community to address this issue?
So through the chair, the specific number of presentations, I can check with my staff. I can't tell you exactly off the top of my head.
Through the chair, so as the medical officer of health mentioned, we are mandated to do work on tobacco and vaping use prevention. And we have a very active group of youth who are noted in the report on page 7, the Youth Health Action Network, who have been working at a policy level in addition to education with their peers to get some of the types of policy initiatives that are in the 3 recommendations through. And they recently, in October, held an event that, if I'm understanding, it was right here, I think, at City Hall, to bring awareness to this issue. And I think they are a very powerful message conveyor as peers to the folks that we're working to influence. So that we definitely are working tightly with youth to influence their peers, but they're working with us to influence the policy change.
So through the chair, I think it is important, though, to note that education is important, but as we saw through tobacco, it's actually changing the environment that changes the behavior most successfully and on a more broad basis.
Thank you very much. And our next member to question is Director Donaldson.
Thanks, through you, Madam Chair. Thank you for the great report. I note in the position statement in the section under nicotine content, it says that since vapor products containing nicotine became legal in Canada in 2018, nicotine concentrations available have increased from approximately 2% or lower to 5%. How is it possible that that happened?
So through the chair, I think effectively the issue is that we need restrictions. And that is within the purview of our federal counterparts.
Meaning it's completely unrestricted, so the companies are just choosing to raise the levels to 5% with...
So through the chair, without speaking on the part of the manufacturers, my understanding is that the manufacturers are responding to their market and seeking to create a device that generates an ongoing base of customers. That's my understanding.
And what do we know about nicotine salts? Nicotine salts.
So through the chair, this is a method by which to actually to heighten the capacity of nicotine to be delivered through these particular devices. So, in respect of delivering nicotine, it was found through research that this was a very effective method to deliver nicotine into the system via e-cigarettes and other similar products.
And so how does a vapor product with a concentration of 5% nicotine compare to a regular cigarette?
So actually, I'll have to refer to staff specifically. I'm thinking through, as I understand it, the way I have read the literature on this issue, when you look at the nicotine content of a standard pack of cigarettes, and you look at that versus what you would get through an e-cigarette, an e-cigarette cartridge or pod is generally used, again, as a non-user, I'm speaking based on the experience of others and that which I've read, often used within the context of 2 or 3 hours, and depending on the product that you're talking about, may contain as much or more nicotine than in a single pack of cigarettes, except you use it in 2 or 3 hours.
Right. Which would explain why youth who are vaping are telling me and their parents that they cannot stop. They're physically unable to
So through the chair, I think there are a couple of things. You get a large dose of nicotine in a relatively short period of time. Add to that nicotine is a highly addictive substance, and particularly so for the developing brain. And I think you have, a very dangerous combination as a result.
Which brings me to my next question. I asked MPP Jelena about why Health Canada has not declared this an epidemic in our country, and the US has. So what is the particular threshold that needs to be met for something to be declared an epidemic?
So through the chair, there isn't a particular threshold per se, and it's difficult for me to speak to Health Canada's intentions or how they judge circumstances, but I would say writ large, there isn't a particular threshold for, in my experience and in having observed that which Health Canada does, they, I believe, seem to address each issue, you know, as on its own, on its face, and make determinations that way. So I'm not sure what is either motivating them or preventing them from making any kind of declaration.
Okay, thank you.
Thank you very much. Our next director to question is Director Cressy.
Thank you. On flavors first, so in the recommendations, we're calling on the federal government to restrict flavors in stores available to minors. Is that correct?
Yes, that's correct.
And I'm trying to understand where each level of government has a role to play. With respect to the provincial government, is there a similar recommendation I'm looking at here?
So through the chair, the different levels of government do have, you know, capacity to make some legislation and regulation. So both the provincial and the federal government have some purview in respect of access to flavors.
Okay. So I guess one question, so under the recommendations, it would be a restriction on flavors in locations accessible to young people, is that correct?
That's correct.
So novelty or specialized vaping shops could still sell flavors under this model?
That's correct, because they are inaccessible or should be inaccessible to young people.
Do we know if there are flavored cigarettes, not e-cigarettes, but cigarettes?
So through the chair, there once were, there are not anymore. Save and exclude for a few products, which are a wine and liquor flavored cigarillos and the like.
And when there once were, is that because government regulation intervened to stop the development of flavors?
That's correct, and that's at the provincial level.
So I guess if we're trying to have a level of consistency between, for vaping products and cigarettes, why wouldn't we have a similar restriction on, outright restriction on flavored vaping products if that exists for cigarettes?
So through the chair, that's certainly something that is worthy of consideration. I think the issue at this stage of the game is when you look at the research and we look at the data in respect of e-cigarettes and their potential to provide a smoking cessation support. The data suggests, and it was recently done by the Ontario Tobacco Research Unit, they have done surveys and it indicates that the flavors, as reported by current smokers seeking to quit, do assist them somewhat, albeit clearly not in the numbers that we were hoping to see.
Okay, so that's the rationale for not having a exact replica of the model for cigarettes and e-cigarettes, because we have seen in select circumstances flavors for adults as a tobacco cessation.
Yes, at this stage of the game, that's our understanding, but of course, one has to continue to monitor and adjust the course of action as need be.
Okay. Your third recommendation involves the city. So just so the board understands, is this a recommendation for you to work with the other city departments to develop similar rules for the use of e-cigarettes or vaping products as we have today for tobacco?
Through the chair, in short, yes.
So no smoking in parks within 9 meters of entrance to city facilities and the like?
So through the chair, it's not, our current tobacco restrictions are for public squares. There are certain park areas it's a combination. We have a little bit through the existing provincial legislation and some of which comes through City of Toronto bylaws. It's not all right now we don't have a restriction for all parks, but yes, it's to line up. What we're proposing is to line up vaping restrictions to existing restrictions to tobacco as currently legislated under City of Toronto bylaws.
Okay, and so beyond what we have done thus far, establishing a license now that's required for those who sell vaping products in the City of Toronto, a recommendation here to develop a bylaw to align the use of e-cigarettes to have the same policies as cigarettes in the city. Is there anything else that the city can do beyond those measures?
At this stage of the game, when I look and when we have looked at that which can be done from a legislative perspective, regulatory perspective, most of the powers lie at the provincial and federal level. We have certain purview over city property and city standards and licensing within the context of the city, but these are the recommendations at this stage that we feel are most appropriate and that were within the city purview.
Okay.
There are lots of things that can be done at the provincial and federal level, hence the first two recommendations.
Okay, and my final category for questions revolves around taxation. So in the report, you go into that British Columbia has implemented a tax on vaping products similar to a tax on tobacco, cigarettes and tobacco products. Why haven't we seen a similar recommendation from you with respect to the province of Ontario here?
Well, I think at this stage of the game, we felt that we have evidence currently in respect of the recommendations made thus far. However, I think it's certainly worth considering, given what we understand from tobacco legislation and our experience with tobacco in the past. It would be moving out into that, into an arena where we don't have evidence, but direct evidence, I should say. But certainly we have some experience with tobacco.
Thank you very much.
Thank you very much, Director Cressy. Anyone else to speak? To ask questions of staff, I should say. I have a few questions. With respect to health benefits, should we not determine the health benefits of a product before we actually permit its sale in any licensed business, as opposed to waiting for us to determine all the things that are unhealthy about it?
Through the chair, through you, Madam Chair, that's a very interesting question. I think when I think about product availability for sale within the Canadian context, that's something that actually does fall at the federal jurisdiction. I think it's actually reasonable to think that through, but it would be certainly challenging, if not impossible, for us to manage that here at the local level.
And because we license businesses and we can determine which business has a license to operate legally in the City of Toronto, would it not be within our purview to also restrict the type of products those businesses can sell, even outside of provincial and federal jurisdiction?
So through you, Madam Chair, I admit I'm not an expert in the legal matters, because that would be a legal question. My understanding, however, though, is that if a product is, legally made available, right, and there's no prohibition, I'm not sure what our purview would be. However, I do understand that, the federal government has a role to play in this. It would be interesting to ask our legal counsel if they have, do we have our legal counsel here? If we would have any jurisdiction over sale within licensed facilities.
Through the chair, I think that's something we could look into and report back on. It might be
So if we gave you some instruction to determine the feasibility of banning all vaping products, aerosolized products from licensed businesses in Toronto, you could bring back a report to give us further guidance on that.
Yes, that's right.
And so this would cover the sale, the consumption, and the trade of these type of products?
Yes.
Or at least the sale and trade?
Yeah, that's something we can look back into.
That would not be out of order?
Not to my understanding. I mean, it might have to come back in a confidential report. We'd have to explore that a bit further, but...
Okay, thank you very much. Anyone else for questions? Did you want to add something? No? Okay. So those two interested, yes, sorry. Director Lepretti.
As Director Donaldson represents TDSB and I'm with TCDSB, I'm wondering, as school board representatives with over, I'd say over 500,000 students, what else can we do to expose the dangers of vaping to our students? And it's not something that you have to answer now, but maybe to come back to us with a report on what else we can do within our boards to expose the dangers to our students.
Through you, Madam Chair, I think there are a couple of things that can be done. We talked a little bit about the Youth Health Action Network. I do think it's important to get, and we've heard around the table, of the importance of providing information to support people making good choices. I would suggest to you, however, that education is part of a solution, but as we've seen with most other behaviors, especially those that involve the use of addictive substances, education will only get you so far, particularly if it comes from a non-peer source. Taking lessons learned from our experience with tobacco in the past, having peer sources of information and active engagement of youth, I think is an important component in terms of addressing the situation that we're seeing in schools. But fundamentally, as I've answered in an earlier question, having regulations and legislation and policy that actually creates the environments that support people to make the best choices for themselves is fundamentally the answer to many of these solutions that impact on public health. Hence, we're asking for these kinds of certain regulations, for legal and legislative changes that actually create an environment that fosters better health and better health behaviors.
Okay. Any other follow-up questions? Okay, seeing none. Any other questions for our staff? Seeing none, then members to speak. I know that Director Cressy would like to speak to this matter, and I know he's got some motions. Anyone else to speak? Director Donaldson. Sir, we are actually speaking in this particular chamber. It's not open to the public. I asked for members to the public to speak. Thank you very much. So Director Donaldson, sir, sir, you do not have the floor. You're being very disruptive in this meeting. I'm not acknowledging you. We are now bringing this conversation into the chamber here. To speak, Director Donaldson, thank you.
Thanks. I just wanted to thank all the staff for their work on this and to say that while I understand that all of these recommendations are very grounded in evidence and what we do know right now, I do have a very strong sense that the evidence that we have available is not as reflective, I think, of the reality out there right now. And so I really hope that staff will keep a very, very close eye on this issue and provide any updates of new evidence that becomes available to this board so that we can take immediate action on it, because I do feel very strongly that this whole issue is deserving of very strong, very bold, and very immediate action. So again, I'm really appreciative of all the work that everyone's doing. And I just finally want to say that our kids desperately need us to do something on this and to stop it, because they are struggling so hard right now, and it's up to us to lead the way. Thank you.
Thank you very much, Director Donaldson. To speak, Director Wong.
Thank you very much, Madam Chair. So I was just following to the comments made by Director Donaldson about the recommendation, but also to this report. I thought the report was very balanced, but I think we need to move this a bit further. Particularly the area we heard from MPP Jelinek about the issue of lack of research, lack of data. And the fact is, I'm not sure if the chair will be putting an additional recommendation to this report, because we know that young people are price sensitive. This is a time where very shortly the Minister of Finance is doing public consultation about the 2020-2021 budget. So it is prudent for this board, through the chair, to speak before that public consultation, or at the same time writing to the Minister of Finance additional PST taxation, because we saw in this report what's happening right now in BC can be done. If it could be done in BC, we should be considering here in this province. But more importantly, the recommendation number 4, Madam Chair, isn't going farther enough. There's no mentioning of the public health, but the school boards, because we're 4 school board, this report is not sharing with them, because it's not just about the City of Toronto. We've got to talk about consortium of all the school boards, but in the same breath, we need to advocate for more research at the federal level, provincial level, but also comprehensive education program, because we need dollars and cents, because our dollar is so tight right now as it is, and we got to have some dedicated resource dollars to address this vaping issue that right now we're not getting. And we got to talk to parents. Parents need to have some resources to address this issue, because their children are using vaping probably in front of them, but definitely behind them. Because we heard the data right now from MPP Jillian that almost 30% of young people in our system are using vaping. So how are we going to address this? So I think we got to have more recommendation. I'm passionate about this issue. I'm so many board members here also very passionate about this issue. I think we need more stuff on this recommendation. So thank you.
Thank you very much, Director Wong. Anyone else to speak? Director Cressy.
Thank you. And I have 2 amendments to place, which have been circulated. The first is to urge the provincial government to adopt Bill 151, 151, as we heard from MPP Jelena, to strengthen provincial measures to counteract the rise in vaping. And the second is to amend Recommendation 3 to request that we get a report back in the second quarter of 2020 on the status of the city's work to initiate a bylaw. Let me begin, first of all, by thanking our staff, the Medical Officer of Health and her team. This board, we requested this report in September. This has come quickly in a comprehensive fashion, and I want to thank our staff for doing that. And I want to recognize the 2 trustees here, Trustee Lopretti and Donaldson, because the school boards have been hard at work on this issue as well. The more we learn about vaping, the worse it gets. I think when e-cigarettes and vaping started, it was kind of seen as a novelty product and a harmless one, and one that might actually help with smoking cessation. But the more we learn, the worse it gets, and we discover that in no way is vaping benign. In fact, there are immediate harmful short-term effects that we're seeing around the world, lung injuries, with the nicotine content, the impact on brain development of adolescents, and that this is actually contributing to tobacco use. And the long-term risks, of which we can assume there will be many, we aren't even aware of yet. And so if we do not act now, we risk undermining decades of effective tobacco control. Decades. And so when it comes to acting, thankfully we're not reinventing the wheel here. We have decades of tobacco control that has been effective in both reducing the harm and reducing the use to look to. And so we need, just as we had with tobacco control, all 3 levels of government to move quickly. Now, in 2014, this board, I wasn't a member at the time, but I believe that Councillor Wong Tam and Perks were. In 2014, this board passed a series of recommendations for the provincial and federal governments around flavors and advertising and research to be done on vaping. Well, 5 years later, after the harms have begun to emerge, we see other levels of government starting to act. And so if there's a lesson here, it's that all levels of government need to act yesterday. And given that this is an urgent issue, that includes the City of Toronto as well. And so I want to again thank our staff for their hard work. This is an issue that is going to come up again and again and again until we act with the urgency it requires. And I'm happy to move the recommendations. Thank you.
And thank you. Are there any questions of the mover? Okay, to clarify the motion, straightforward. Okay. Anyone else to speak? Okay. I will be speaking. I'd like to move a motion, and the clerk can put this on the screen. that we would direct the medical officer of health in consultation with relevant staff to report in the second quarter of 2020 on the feasibility of restricting or banning the sale, consumption, and trade of aerosolized liquid products, vapor products in Toronto. Just to speak to it very briefly, I think, and to thank the staff for this excellent report, I believe that everything that they've already put forward in front of us is giving us some indication that we need to do more and we need to do it faster. The fact that we have a number of school trustees who are actually with us and who have actually raised some concerns of the activity that they're seeing on school properties, recognizing that the youth in particular and the children of Toronto are being targeted, and the line of defense between them and their health and their future health is really us at the Board of Health, and what can we do in the City of Toronto to eliminate and to reduce the harmful effects of this product, which seems to, we all agree that we don't know enough, but what we do know right now as a baseline is that it is not necessarily a healthy product. We're asking them not to pick up the habit, we're asking them not to start the consumption, we're asking them to basically not start smoking if you, to not pick up the product but you don't smoke. We're already saying this, but at the same time, availability of this product seems to be everywhere. I walk into a corner store adjacent to schools, and I see more of this product for sale and advertised around these convenience stores and drugstores than just about any other type of advertising. So it's extremely profitable, but there is going to be a very clear financial impact on the Canadian health system and those in that of Toronto as well, if we don't actually address it. And I'm fearful that because we started asking for provincial and federal changes, we asked the provincial and federal government to step in back in 2014 when this was first flagged about 5 years ago, and they have been very slow to respond. I recognize that this particular motion may seem like we are, moving rather aggressively, but when you put into the context of the fact that 5 years later, we're still trying to protect the children and the youth of Toronto, and we haven't made a lot of progress. We are now tinkering around the edges, saying that we should probably eliminate advertising, we should probably eliminate some of the display material. That's 5 years already too late, and the population that's now stepped forward to start this very addictive habit that seems to lead to very immediate decline of physical as well as mental health. We're also going to see much longer as this trend of consumption continues to rise, and as vaping becomes more acceptable in social environments, as we are seeing this across the city. So that's what I'm doing. I think we need to be able to just understand, is there more that the City of Toronto can do to protect its residents, especially the vulnerable and the young? And if there is more, then let's get that advice from staff, and then they can provide some recommendations on what next subsequent steps that we can take. Are there any questions of the mover? Yeah. Go ahead, Director.
Just for clarification, so you're requesting a report back on whether further restrictions are possible. This is not the board, you're not asking the Board of Health to call for a complete ban today.
No, I'm not, and I don't think we actually have the right to, yes. We don't have the purview within the Board of Health to implement a ban. This will be something that we would have to do through the City of Toronto, and even then I know that there are going to be very clear regulations and recommendations that will probably have to go to other standing committees, including municipal licensing and standard around licensed businesses. It will have to probably go through the executive and then a final council decision. And then to implement a bylaw, we oftentimes know that there is also times a legal battle ahead of us to even uphold the city's bylaws. Okay. Any other questions of the mover? Director Wong.
So I fully support your motion, Madam Chair. I do also want to move a motion with regard to this item dealing with the taxation we had in this report. And the fact we also asked MPP Gillen about the fact that young people is price sensitive. And there's nowhere in this report, the Medical Officer of Health already indicated in the report about the fact that in BC they're doing it. This is time for us, through the chair, urging the provincial government as it plans the 2020 budget to include this piece of item. So I think it's important for this board to be advocating for this kind of increase in PST. So can I give this to the clerk, Madam Chair?
We could certainly hold that down. Is your motion ready?
Yeah, I've written it in my little piece of paper. Can I-
So if you can move that piece of paper to the clerks, they'll have that typed up for you. I recognize that you I'll also acknowledge you to introduce it as soon as it's ready. Okay. Are there any other questions for the mover? Okay. Seeing none, are there any other speakers, or do we need to hold this matter down until we get this particular motion prepared? I think we're going to need to do that, so we'll try to vote on everything together. So I'm going to hold this item down. We'll bring it back up as soon as the motion is ready, or we could probably take how long is it? Oh, it's very, why don't we take a 2-minute recess, and then we'll come back to the meeting very shortly. Okay, we're going to bring this meeting back to order, and what I'd like to do is, number one, remind members of the public under council procedures you cannot disrupt this meeting, and I ask you to respect the committee's proceedings and act appropriately. And also a reminder to members to prepare your motions and amendments in advance, and that will probably help us move the meetings along much more efficiently. So I want to just acknowledge Director Wong, you have a motion that you'd like to place before the board.
So thank you very much, Madam Chair. So I think it's been circulated, my motion's been circulated, and I think it's also strengthened what the chair's motion dealing with the whole issue, encouraging the province to do more. But very clearly, this is a timeliness of my motion, because as we speak, the province is getting ready for their budget for 2020. So it's before you, I don't need to read it, but the fact is that we need to ask for more taxation with regard to this deadly product. Thank you.
Okay, thank you very much. Are there any other speakers with motions? Okay, any other speakers without motions? No? Okay, so we're ready to vote. If we can probably take the motions as an original package, is that all right?
Yeah.
Okay, all those in favor? Any, recorded? All those in favor? This is a request for a recorded vote.
Okay, all those in favor, so Director Ashna Bowery, Director Stephanie Donaldson, Director Angela Johnson, Director Cynthia Lai, Director Joe Cressy, Director Kristen Wong-Tam, Director Ida Lepretti, Director Jennifer McKelvey, Director Kate Mulligan, Director Gord Perks, Director Peter Wong, and Director Sue Wong. Any opposed? And that carries unanimously.
Do we need to amend it? Yes. Okay. Okay. That's it. Okay, so the item has been adopted as amended. Thank you very much. We will now move to our next item, and thank you very much, members, for that very good discussion. HL 12.4, Toronto Public Health Organizational Review. We do have members of the public who are registered to speak on this particular matter. The first person I'd like to call is Aisha. Oh, we have a presentation. Oh, sorry. My apologies. I didn't want to take away your time. Okay. So we have a presentation from a medical officer of health, and please begin when you're ready.
Okay. Thank you, Madam Chair, and thank you for all of you for your attention this morning. I will be presenting to you on the screen a presentation regarding our report on Toronto Public Health's organizational review. You may recall that this item was actually raised and brought up at the October Board of Health, and there was a particular request for an update to be provided in respect of the status of the review, and that's what we're going to be doing today. So as you can see here, we're actually back on slide 2. Just to give you a little bit of context, Toronto Public Health has undergone a number of changes, much growth, and evolving priorities, not surprisingly, as our city has changed and grown over the many years. However, as it turns out, Toronto Public Health as an organization in totality as a whole has not actually been reviewed since the organization itself was created in 1998, the whole organization, right? There have been smaller reviews and specific subsegments that have been reviewed, but not the entire organization reviewed since back in 1998. So as it turns out, it's within that context that in 2017, as part of the budget process, City Council directed the then Medical Officer of Health, or the incoming Medical Officer of Health, I think both of us were directed at that time, as I was just coming in, to conduct an organizational review. And specifically what Council was looking at, given that it was part of the budget process, was for the organization review to identify opportunities for savings, and second, to assess the organization's design with a particular look at the management span of control. Now going on to the next slide. So that was Council's direction in 2017 as part of the budget process. However, in between that 2017 budget and as we moved into 2018, there were a number of emerging issues that were identified and felt to be of validity and importance in terms of inclusion in the organizational review. And these included things like budget pressures that relate to population growth and an increasingly dense city, the new 2018 Ontario Public Health Standards, which require an increased focus on the use of evidence and in particular on policy interventions to address population health. There were also other emerging issues that this board will be very familiar with in respect of what's pressing on the city, things like housing affordability, mobility, and other challenges that face our growing city. So, taken all together, when you looked at the council direction and the emerging issues that were coming up as we were moving forward as an organization, we put these together to determine some specific outcomes that the organization review would actually achieve or address in its process. And those are articulated here on the slide. Things like identifying strengths and opportunities for improvement in respect of Toronto Public Health's structure, its processes, and its capacity to deliver on its mandate. Identifying ways to deliver increased operational efficiencies while maintaining effectiveness. Reviewing other public health organizations to gain insights into how other organizations are delivering, particularly on progressive and evolving public health programming. And finally, ultimately, to provide a recommendation in respect of an organizational design and an implementation plan. So that takes us forward. We're now at April 2018. At that time, we hired an external consultant, MNP particularly, to conduct the organizational review. The team from MNP actually began their work with us in May of 2018 and completed their review in December of 2018. The review had a variety of inputs that were involved, including inputs from staff, from stakeholders of Toronto Public Health. We looked at other jurisdictions and other promising practices from the field, through jurisdictional scan. And we looked at other basic approaches within the literature, things like span of control analysis, other practices involving a functional inventory, and ensuring that there was an analysis done so that we could assure ourselves that we were lining ourselves up well in order to discharge our obligations under the Ontario Public Health Standards. So taken all together, using all the information that was obtained through that review process, the consultant team developed a current state review, a new organization design, and recommendations for how Toronto Public Health could address public health issues and challenges and the evolving needs of the residents of this city. So turning now to the specific findings of the review, first let's look at the current state assessment. And the current state assessment at Toronto Public Health identified a number of needs and opportunities for improvement. And these are explained to you on the slide, but just to give you a little further detail. One of the opportunities that was identified through the review was the opportunity to put similar functions together to create strategic and program integration and accountability rather than having different units or directorates and teams within the context of the organization functioning in a siloed manner. Other opportunities, and again, I'm going through the slide here with you, the need to create a foundational support function so as to coordinate services across Toronto Public Health and to liaise in a more consistent and coordinated fashion with the city's corporate service, rather than having each directorate in each section within Toronto Public Health approaching our city partners on human resources issues or information technology issues. It was also identified that there was an opportunity to make full use and better use of existing roles by reconsidering how work is assigned rather than relying on traditional approaches that may have worked in the past, but perhaps didn't work quite as well with the evolving needs of our public. There was also an opportunity identified, particularly given increasing funding pressures, the need to develop an agile and responsive workforce and organizational design that can more nimbly adjust to the needs of a changing population. And finally, there was identified a need to increase the use of evidence and data in program and intervention development to ensure that we're able to achieve, that we're best positioned to achieve health outcomes that we seek to achieve in the most effective and efficient use of our resources. And then things, we were progressing, I think, reasonably well. And then came April 2019, which changed a number of circumstances, and the folks around this table are quite familiar with that. The organizational review work was in fact paused for us in April 2019. We were proceeding, after the review was done with our consultants and effecting some of these changes in order to make sure that we were able to deliver. But with the provincial budget announcement, of April 2019 concerning the modernization of Ontario's public health sector, we were forced to actually pause our work, given the significance of that change. We are still in a circumstance where the province has yet to really articulate its long-term vision in any detail. And there are indeed questions that exist around what the province foresees as its plan with respect to public health units, their governance, their mandate, and their funding. But, as this board now knows through previous presentations here, we do have some greater clarity around our financial situation for 2020, and as such, we are now in a position to continue or resume the implementation of some of the recommendations provided through the organizational review process to help position our organization for future success. I would be remiss, however, if I didn't tell this table and remind this table that, again, from an operational perspective, we know that we have obligations to you and ultimately to council as they approve the budgets around what services we will continue to provide. And while we are moving forward with the organization review, things that actually change the obligations that we have made both to you as a board and to council as the ultimate governor of the finances will always come here first before anything changes. So let's now turn to the next slide and to give you a high-level summary of the main recommendation, or one of the main recommendations of the review. And that was regarding the introduction of a new organizational structure that groups our functions into these 4 key areas to solidify what we can do in each of these areas. So they're health protection, health promotion, effective public health practice, and public health foundations. At a very high level, health protection is that area which is focused on public health's mandate of preventing and reducing the ill impact of infectious and communicable diseases, and relates to reducing or eliminating exposures to hazards in our environment, and talks about the kinds of activities that will include prevention, will include treatment, inspections, enforcement, and containment. That's all within the health protection function. Health promotion works within a social and environmental determinants of health framework to promote healthy behaviors and shape environments that actually give rise to better health across the lifespan, all focused on improving health outcomes and, of course, reducing inequities in health. Effective public health practice is the area or the section or function within the organization which is meant to provide central and consolidated resources so that we can identify, gather, and organize the latest available and the best quality evidence that exists, information, and develop interventions, our understanding on the interventions, the best available interventions, including enabling technology, so that we can continue to develop and deliver leading-edge health promotion and protection interventions so as to advance health outcomes. And finally, public health foundations, which supports the effective planning and operation of Toronto Public Health through such activities as strategic planning, community and stakeholder relations, project management, and our liaison with key corporate service functions. So that's the basic structure, the core functions, and the way in which the review suggested we would best organize ourselves to meet the needs of a changing population. Moving to the next slide. Effectively, what happened was that as we had this, functional structure, moving towards this functional structure actually provides the framework for us to start to implement proactive changes. And this is important, particularly in the context of that which is happening with the province and their so-called modernization efforts for public health. That is their term. So the kinds of things that we have been able to do as a result of this functional structure, and given what we know from the province's modernization efforts, we've been able to try and adjust service delivery to increase organizational efficiency and effectiveness. We have used the structure to help us address span of control as directed by Council back in 2017, particularly in those areas where the number of direct reports was relatively small. We've used this opportunity to better coordinate the work of teams which have similar goals or functions, to develop and create program synergies, and in some cases to improve the client interface, where we've had programming that sometimes interacts with external clients, but it sits across several different areas of Toronto Public Health. We understood from our clients that that was not the most satisfactory interaction for them, to have to go to 5 different places within, or however many different places within Toronto Public Health to address their various needs. Bringing these programs together and aligning them better gives us an opportunity to better meet client needs in a more user-friendly way. And finally, we have also taken the opportunity to embed policy functions within program areas to more effectively meet policy requirements as stipulated in the 2018 Ontario Public Health Standards. So I'm now taking us through to slides 10 and 11. These are clearly very high-level pictures, and from a projection point of view, I'm afraid that that means that they are challenging, if not impossible, to read on the big screen, and for that I do apologize. Yeah, we'll have to try to figure out whether we can expand. It is a little bit of a vision test, and for that I apologize. We'll have to get you stronger magnifiers. However, again, this is just a high-level picture. We can see what we can do about blowing them out. I admit, even with my progressive lenses, I had some challenge in reading the fine font. But suffice it to say that on the first slide, that's slide 10, what you have is the Toronto Public Health Organizational Chart for 2018. And on slide 11, and I do hope I have my numbers correct, the second is that slide 11 is our current organizational chart. I can tell you that in general, adjustments have been made to reflect the 4 functional areas as recommended and articulated in our organization review that I spoke to earlier. You'll also note that there have been some adjustments made to span of control and to address the span of control concerns and direction that were provided by City Council back in 2017. And finally, you'll note that there are some adjustments made in the organizational pictures as you look back and forth between them to merge some areas so that we can continue to deliver on our obligations to our public within our mandate, while also trying to do the best we can in terms of increasing effectiveness and, yes, efficiency across our organization. I think it's important to note that there are, and I know those around this table are familiar, that there are some significant funding pressures that are looming in front of us outside of some lack of clarity yet in terms of what the province envisions for the public health sector. So those are our two organizational charts. Moving on to slide 12. Our plan is to continue to implement the recommendations from the organizational review so that we can continue to demonstrate leadership in the broader field of public health and to serve the residents of Toronto as best as possible, regardless of what our funding circumstance looks like. We recognize that we don't have full control over that which happens within the broader public health sector, whether it's from a governance, a mandate, or a funding perspective. However, we are patently clear about our objectives and our desire to improve the health status of the population, to reduce disparities in health status, and to ensure that we're prepared for and able to respond effectively to outbreaks and emergencies. We are also patently clear as an organization that we must focus first and foremost on prevention, and we must do so in a population health way. If we do not do those activities, there are no other partners in the system who are positioned, poised, or skilled to discharge those obligations. On to the next slide. We are very much in what I would characterize as an environment or climate of uncertainty. And I've mentioned to you that we still don't know where the province intends to go and what their ultimate plan is in respect of the public health sector, its governance, its mandate, or its funding. However, as I've mentioned, it's our job and it's our obligation as Toronto Public Health to ensure that we stay focused on delivering those core objectives. And I can't say them enough, and I know that when I go around, and I do go around quite a bit to our various sites throughout the city, to talk to staff, to make sure that we all stay focused on the core objectives, improving health status, reducing disparities, and ensuring that we're best prepared for and able to respond effectively to outbreaks and emergencies. I think the interesting thing about these objectives is if we're able to actually succeed on those objectives, we, by definition, enhance the sustainability of healthcare. So with that, I'm going to take us to our last slide and give you some concluding remarks. Oh, was that my last slide? Okay, I thought I had one more. So let me just bring you to concluding remarks. This is an important time in public health. Our province is actively reviewing and undertaking what they've described as a modernization initiative. We know of funding changes. That's, at least for the short term, is fairly clear where they're going on that. The long term remains a little bit uncertain. We know that the province has embarked on a consultation process in respect of the public health sector. And we know that we are serving a growing city that has a number of complex challenges that we need to address and that have significant impact on health status and on inequities and disparities in health. I do look forward, and I know I can speak for the entire organization when I say that we look forward to ongoing support from the Board of Health and your important role in governance of public health as it's conducted here in the city. I know that we can count on you, on your support, as we move forward with our organization enhancement efforts, in our organization review efforts, all aimed at improving health status, reducing disparities, and ensuring that we're able to respond effectively to outbreaks and emergencies. I know that this table does not need to hear more about the importance of the social determinants of health and how key it is for us to move forward in ensuring that we address the social determinants of health with a prevention lens and with a population health lens. It's interesting, having been to many tables around the public health modernization efforts, I will tell you that it is important for all of us at this table to focus on those social determinants of health and recognize that there is a distinction between addressing the social determinants of health, which is a fundamental role for local public health, and addressing individual social needs, which is also important, but perhaps better suited to other stakeholders and partners within the system with whom we know we have to work if we are going to be successful in improving health outcomes and reducing disparities. So with that, thank you, Madam Chair. I will turn it back over to you.
Okay, thank you very much for the presentation. We are going to hold down questions for staff until after we hear from members of the public. I'd like to call our first speaker from the public who's registered, is Aisha Adami Magwinta. Thank you for that correction. Our next speaker is Brian Noble, and if I can actually invite members of the public who are interested in speaking to item number 4, please let the clerks know and they can update the speakers list. And will you be speaking together to share 5 minutes, or 5 minutes for the one? Okay, when you're ready, please proceed.
And members of the Board of Health for the opportunity to depute to you today. With all the political changes taking place around us, we want to reinforce the importance of sexual health services to the ongoing health of the people of Toronto. The clinics that we represent, IWHC Toronto, Hassle-Free Clinic, and the Birth Control and Sexual Health Centre, have worked along with pioneers like Dr. Marion Powell, Sue Johansson, Dr. Sheila Bassur, to ensure that the provincial government mandated services and committed funding to adequately address the sexual health needs of our city. The network of sexual health clinics that has been established over the years by Toronto Public Health is one of the most effective, efficient, innovative, and well used in the entire country. It targets high-risk populations such as men who have sex with men, those without health cards, and those without access to a family physician. Our 3 clinics, while independent with our community boards and staff reflective of the communities that we serve, have been funded by Toronto Public Health, and we are proud to be well integrated into this system, which provides necessary and well-coordinated services. Over 200,000 people in the city have no status and little or no access to health care. They use these services because there is no health card requirement, just a welcoming environment without stigma. So do other members of vulnerable, underserved communities who may have cards but limited access to family physicians and nowhere else to go. The sexual health clinics provide low-cost birth control and free medications to treat sexually transmitted infections. The Wellesley Institute recently reported that 1 in 5 working Ontarians have no drug coverage. For racialized communities or recent immigrants in part-time employment, and excluded from coverage, these services are a lifeline. The very reasons that necessitated the establishment of the sexual health program decades ago still exist, and Toronto Public Health continues to acknowledge these imperatives through this excellent network of sexual health clinics. I know that you are familiar with the clinics and the statistics, but I'd like to reiterate what we're facing. The combined incidence rate for all reportable sexually transmitted infections in Toronto increased by 58% from 2008 to 2018. This mirrors trends in other Canadian and international jurisdictions of a local and global decline in safe sex practices. Sexually transmitted infections made up 63% of commonly reported infectious diseases in Toronto in 2017. The high and increasing numbers of STIs underscore the importance and the need for sexual health education, counseling, and clinical services. The asymptomatic nature of STIs means many cases go unreported and that the true number of STIs may not be known. Among young women, early stages of gonorrhea and chlamydia are often asymptomatic and therefore go untreated. Approximately 40% of such cases can progress to pelvic inflammatory disease, leading to chronic pain, damage to fallopian tubes, an increased risk of ectopic pregnancy, and possible infertility. STI prevention is clearly desirable, and early detection through clinical services is very important to prevent the spread of STIs and HIV and lead to earlier treatment. Knowledge of HIV status is recommended for all sexually active people through testing. Individuals at high risk should be tested more often. Despite advances in testing and treatment, HIV still presents a large health concern. Approximately 50% of HIV-positive cases in Ontario are from Toronto. Those that are not diagnosed and treated early have an approximately 50% reduction in life expectancy. In 2017, there were 500 newly diagnosed HIV cases, 83% of which were male, and 79% of those were men having sex with men. In terms of women and contraception, self-perceived ability to make informed choices is a key component of positive sexual health. Access to services for low-income women, those without health cards, and those without a primary health care physician, where they can purchase low-cost contraception in a safe and non-judgmental environment, is still crucial. Providing free condoms is also very important. Consistent condom use is a sexual health tool for protection against STIs and preventing unplanned pregnancies. And yet, 55% of sexually active adults in our city reported using no method of protection. Oopsie. Abortion access for those without health cards can be close to impossible unless they can be directed to the one site in the city that does not require a health card or payment for procedure. Unplanned pregnancy prevention is critical for these vulnerable women whose choices are so limited. We believe the situation speaks for itself. The sexual health program that has been providing these necessary services must be maintained and strengthened, responding to the needs that are still present and growing. There is no one else to take this on. We congratulate Toronto Public Health for the work it has been doing in this critical area. Our boards and volunteers have also been working hard in our communities over the last year to preserve public health. We also want to acknowledge the inspiring role of Acting Chair Kristen Wong-Tam, Acting Vice Chair Joe Cressy, all the members of the Board of Health, the Medical Officer of Health Eileen Davila, and Mayor John Tory in the fight to keep public health an integral part of the Ontario healthcare system. Thank you so much.
Thank you very much. Are there any questions for the speaker? Director Cressy, please proceed.
Thank you, and thank you for being here. So you're here today speaking on behalf of IWHC, correct?
IWC Toronto, Hassle-Free Clinic. My colleague Jane Greer is here from there, and the Birth Control and Sexual Health Center.
Great. And just for the benefit of members of the committee, IWHC stands for?
Formerly known as the Immigrant Women's Health Center, and we chose to change our name a couple of years ago as we started to see men at our clinic, as we know that the need for sexual health testing for men is as critical as it is for women, and especially we offer language. We serve in 7 different languages, so that is something that allows people that don't have the language skills to be able to come to our clinic and get counseling and testing.
And so, and you're here to, just so I understand, you're here today speaking on behalf of a number of organizations because you all receive funding for sexual health programs and services that you provide through Toronto Public Health.
That is correct. We are funded, all of our 3 clinics are funded by Toronto Public Health. So we are integrated into the public health system, but we're not actually public health clinics. We're independent clinics.
Okay.
Yeah.
And so do I understand correctly that the reason you're deputing on the item related to the organizational review is because you want to ensure that these clinics continue to receive funding on a go-forward basis?
That is correct. We serve a large number of vulnerable communities and peoples through our clinic work. We offer a lot of access in terms of extra hours that are not available through some of the public health clinics. And so we feel very strongly, and people in our community as well, access these services quite regularly, which is shown through the higher numbers of testing and positive STIs that we see through our clinic work. So we feel that this funding needs to be maintained, as well as the funding for all sexual health clinics that are in the sexual health clinic program, which is a critical service, an imperative service to the people of Toronto.
Okay. Those are all my questions. Thank you.
Okay, thank you very much. Any other members to question? I have a couple of quick questions. With respect to the report that we just received from the Medical Officer of Health, there wasn't a lot of detail in terms of, there was a big chart, I think we saw, it was very difficult to read, but I don't think we got into the details of the big overall changes. There is definitely going to be some shifts. Were you given any indication that you believe the sexual health clinics would be at the risk of perhaps seeing their budget cuts, or perhaps being asked to reduce services or alter their service?
I can tell you from our experience, we were at this table, I was at this table 5 years ago, I think, 5 years ago now, when budget cuts were introduced into Toronto Public Health by Mayor Ford, and Immigrant Women's Health Centre was one of the first sexual health clinics on the table. So it is always a risk. It has been a risk throughout the history of sexual health clinics, especially the independently funded ones. So whether there is an explicit or implicit risk, we know that it's there, and so we felt it was very important for us to come and show the importance of these services to the people of the City of Toronto.
Okay, thank you very much. Thank you. Okay. All right, I'd like to call our next speaker, Ryan Noble. Ryan, welcome.
Thank you.
Okay. And you'll have 5 minutes on the clock when you're ready.
Thank you, Madam Chair. Good morning, members of the Board of Health. I want to thank you for giving me the opportunity to come and speak to you here today. As was said, my name is Ryan Noble. I'm the Executive Director of the North York Harvest Food Bank. I'm also a member of the Toronto Food Policy Council and on the Board of Directors of Feed Ontario, which was formerly the Ontario Association of Food Banks. Just for those of you who don't know, North York Harvest Food Bank is the primary distributor of emergency food in the northern half of the city. Sometimes the area is referred to as the inner suburbs of Toronto. We support about 40 different programs, 40 different agencies, I should say, and in turn deliver about 80 different food-based programs, ranging from community food banks to shelter programs, drop-in meal programs, neo, post, and prenatal programs as well. Over the course of the last year, 40,000 Torontonians accessed our services, and when you combine that with agencies in the southern half of the city and in Mississauga, there were over 1 million visits to food banks in the GTA last year. I will say that we as an organization have been more vocal on Toronto Public Health this year than we ever expected to be. We do not receive any funding from Toronto Public Health. In fact, all of our core operations of distributing food are funded through private donations or through private fees that we collect. So we, not to say it in the wrong term, but we have no vested interest ultimately in the budget composition or funding of public health as an organization. What we do have an interest in is we have seen firsthand the impact that Toronto Public Health, and specifically Toronto Food Strategy within public health, has had in partnership with organizations like ours for the clients that we serve and within the communities in which we operate. So I am here today to the best of my ability to speak on behalf of those clients and those communities. To that end, we are, I want to express gratitude. We were here going back into the spring when we collected hundreds, if not thousands, of signatures protesting the provincial government's cuts to Toronto Public Health. It was my privilege to present that to Councillor Cressy, MPP Faisal Hassan, who is a North York Harvest local MPP, so that those could be formally introduced into the provincial legislature. We were also here last month speaking to the importance of having dedicated, strong staff support for the Toronto Food Policy Council. And with that, I want to express my gratitude for seeing that position elevated at a management level. I think that's critical to the type of work that we need to do. But I am also concerned, and I would like to share just some quick observations with you, that in the new structure we will see food as a concept, food as a strategy, diminished and narrowed in its focus to issues around disease prevention and nutrition. And certainly food has a significant role when we're talking about things like diabetes or heart disease or cancer. But for those of us who operate as practitioners in the food world, in the nonprofit sector here in Toronto, we know that food is so much more than that. And we know that food is a critical strategic lens, and that when you apply food as a strategic critical lens and look at a neighborhood through that lens of food and food security, you cannot help but deal with certainly issues of nutrition and public health in its traditional sense, but also the way the economy works, who is participating, who is not participating. Also the public policy regime and how it supports people, particularly our most marginalized communities, in meeting their basic needs. You cannot look at a neighborhood through that food lens and not come across issues of climate change and community resilience in the face of climate emergencies. So you see those connections being drawn between the economy, the environment, our local communities, our individual health. And this is particularly important here in the city as we tackle our commitments as a C40 city with regards to climate change, and we face the incredible challenge of growing inequality. So for us, this is not sort of an academic discussion. It's not about intersectionality and these types of things, although that's an important discussion to have, but it's not one I'm capable of leading. I can point to specific interventions, specific projects that we've done as an organization in partnership with Toronto Food Strategy, planning tables around resilience and how we would deal with climate change shocks, retail-based models of how we can provide food supports in and above what can be done through private charities to those who are struggling to meet their food needs. Other types of initiatives around those key important things. So for us, what we see and what I would like to share with you is the work of Toronto Food Strategy at a very strategic level creates a multiplier effect. And through very, very soft interventions with organizations like ours have a ripple effect throughout our community on some very, very key files. And I encourage you in whatever structure that Toronto Public Health emerges within, that key role as a strategic lens by which we examine our communities is protected and maintained.
Thank you very much. Are there any questions of the speaker?
Thank you, Councillor.
No questions? Okay, thank you very much, Ryan.
Thank you.
So I don't believe that there are any other members of the public here to speak to this item. We can bring the conversation back internally. Are there any questions of staff of their very detailed presentation? Very big presentation anyways. Okay, seeing none, okay. Members to speak. Director Cressy.
Thank you. And I have an amendment, if it can be placed. It was advance circulated. The reason I didn't have questions, in case people were wondering, is because this is a really, really big item. This was initiated and reported on around the time that we had an election and a transfer of the Board of Health in terms of turnover and new members. It was an item that was lost, as the report noted, in part because of provincial announcements this past spring. And it is also uncertain in light of provincial restructuring, but then we can't take away from the fact that there was work that was done internally previously on this. I think it needs a deep dive. I think from a board level, as the chair of this board, I want to be part of doing that deep dive into what is the organizational review going forward, especially in light of provincial changes. And rather than have an item that's at the end of a committee meeting, at a board meeting, when we're all rushed, there's always lots on the agenda. I would like to have a focused subcommittee, just as we do with budget, to delve into this, to come back to the board with recommendations so that we move forward appropriately. In conversations with members around the table, I've heard from Director Perks and Mulligan, who have both expressed interest. I've recommended that the three of us take on that work on our behalf. If there are others who would like to join, you're more than welcome to self-nominate, but the three of us have agreed to be, to take do the time and take the lion's share at this early juncture. And so with that, I'd be happy to move that amendment and proceed.
Okay, thank you very much. Are there any questions of the mover? Okay, seeing none. Actually, I do have one question. Is there an anticipated report back schedule?
As number 3 in the motion is that the meetings will be called at the will of the chair, and I put myself down to chair the subcommittee. So I will endeavor to make sure that we're coming back in 2020. I would say probably in the second quarter. As fast as we can, I would imagine probably early in the second quarter.
Thank you. And with respect to the deep dive, and I do appreciate the fact that yourself and Director Mulligan and Perks is going to do the heavy lifting for us. I think we're all very grateful that you'll do that. But the deep dive and some of the concerns that were already raised by the deputants, because once the report leaves us and the work is going into this new almost subcommittee. If there's any major flags, anything that we should be aware of, I recognize that you'll be calling the meeting, but reporting back in 2020, is there anything that we need to know if there's something that needs to jump back to this board into a larger public venue, more public facing earlier than that?
So what I would say, as the medical officer of health noted, anytime there are any changes, this board will be apprised. And so as a subcommittee, we will delve in. And so if there are changes if there are items to discuss sooner than a full and comprehensive report, we'll bring it back.
Okay, thank you. I'm very satisfied with that. Anyone else? Questions of the mover? Okay, no. Anyone else to ask questions? Sorry, anyone else to speak? Director Perks.
Thank you, and thank you, Chair Cressy, for asking me to be involved in this effort. This is, it may not look like it, but this is actually the most important thing we will do during this term of office on the Board of Health. I've been in and around Toronto Public Health for a lot of my working life, sometimes as a community activist working on environmental determinants of health, sometimes as a member of City Council. And while it's true we haven't completely reformed the structure of Toronto Public Health in a long time, there have been quite a number of efforts over the years to really dive into service delivery and outcomes and policy development and all of that. I can recall 5-6 years ago, we did a review of the strategic plan of Toronto Public Health. And it was a vastly different process than what's been imposed by Toronto City Council here. At that time, there were retreats that board members went to together with senior staff from Toronto Public Health, but most importantly, with community organizations and academics who were actually doing the work in the community, doing the work to look at some of the stuff we heard about in terms of how complex food issues really are and sexual health issues really are, and how all of these things layer together. And through that, we were able to design both some of the organizational structures and some of the policy work in real partnership with the best learnings from a lot of different people in the health sector. And then we need to remember that our current premier once sat on Toronto City Council and was deeply critical of that kind of work. There are people out there, and I would say our current premier is one of them, who think that health is you go to a doctor and they either send you to have someone cut you or they give you a pill, and that's health. And it's just fundamentally wrong. It's just fundamentally wrong. The number of people that we know in the building we live in and whether we can talk to them about how to prepare healthy food is just as important as going and talking to a doctor. And Toronto Public Health has a fantastic history of not only facilitating those conversations, but developing the thinking that facilitates those conversations and teaches all the other public health units how to do it. And those critical roles of working with community on developing program, developing policies from that, and being a world leader in that thinking is something we can't lose because we've brought in a private consultant, private management consultant with no health experience to look at span of control. And I know City Council, Toronto City Council wants to save money and be more efficient, but this is one of those moments where we have to ask, at what cost? And that's why I think it's really important that we have some members of this board get right into what's going on. We may have to bring in some people from the broader community to give us advice. We can't lose those things that have made Toronto Public Health a true global leader in thinking about how to have a healthy city.
Okay, thank you very much, Director Perks. Anyone else to speak? Okay, seeing members of the public, under council procedures, you cannot disrupt this meeting. I ask you to respect the committee's proceedings and act accordingly. We don't have any other speakers. We're ready to vote. All those in favor of the motion before us? Any opposed? That carries. And I want to thank staff for that. We do have two final items before we can conclude, and they are our new business. So, which one is first? Okay, so item number 6 is a letter from Councillor Cressy, the Ministry of Health discussion paper on changes to public health in Ontario. Councillor Cressy, would you like to move the recommendation in your letter?
I have an amendment to it. You'll forgive me. And just to speak to it, the amendment can be placed, which is to request the Ministry of Health and the Special Advisor to the Minister of Health on Public Health Modernization to consult directly with our board and TPH on their changes. I've requested a formal meeting and have not yet heard back, and I know Dr. Davila has also requested a meeting, which is not taking place yet. So that's to formally request that. This is, the Ministry of Health released a discussion paper, and they are soliciting feedback from the public and organization and stakeholders on that discussion paper by February the 10th. And so the motion in front of us today in the letter is to request Dr. Davila to report to our January 13th meeting on the status of consultations, any feedback and advice that she has for us with respect to the modernization paper, such that we as a board might consider whether we take a position on it, but also whether as a board we want to be encouraging others to provide feedback through the survey. So we'll be having that conversation in January, and that's the reason and the rationale for the recs in my letter. Thank you.
Okay, thank you very much. Anyone needing to ask questions to clarify the motion, the amendment? Okay, seeing none, we're ready to vote. All those in favor? Any opposed? That carries. Thank you very much. Okay, and motion to adopt as amended. All those in favor? Any opposed? That carries. Thank you. And our last item is a letter from Councillor Director Perks. The title is Anti-Black Racism Training. Director, did you need to speak to this particular matter?
I just think it's something that's valuable to do and be happy to answer any questions if anyone has them.
Okay, thank you. Any questions of the mover? Director Lai.
Thank you. I just want to ask about the Taibu Community Health Center and partners. Can you name who are some of these partners? Can you name who are some of these partners?
So we have a couple listed here in the motion, if you'll see. There are others. I thought rather than listing prescriptively everybody who's going to be involved, have the medical officer of health work with some of these organizations to bring in the best expertise for us.
So it's basically not just a Taibu, maybe anybody who is in citywide.
Rather than having me pick all those people, I thought we're directing the medical officer of health to do it. She can work with city staff in our anti-Black racism unit to find the absolute best leadership for this session.
Okay, thank you.
Okay. Anyone else to ask questions? Questions? Councillor McKelvey.
Are you considering this is one meeting, multiple meetings, just in terms of our schedules? I think it's
I'm hopeful we can do it in a
likely to
single
get
meeting.
everybody together.
No, we should do it in a single meeting.
And is it going to be held down here, or can we hold it at Taibu?
There's so much flexibility here, you wouldn't believe it.
Okay, because I vote for Taibu.
I don't think there's a vote before us, but your recommendation and suggestion is noted. Yeah. Okay. Anyone else with questions for the mover? Okay. Seeing none. Anyone else to speak? Okay. Seeing none. All those in favor? Any opposed? That carries. Thank you very much. So we don't have any other items. We've cleared everything on our agenda. I want to thank all the directors and staff for today's very effective and efficient meeting. Thank you.
Thank you.